Namaskar, I'm Ashok Vyas. This is a special edition of Asia, a voice of the community on ITV Gold. This Sunday, we will be sharing some of the important stories related to the collective experience of global crisis caused by invisible enemy coronavirus. In today's episode, we will have a conversation with Consul General Sandeep Chakravarthi ji, who joined live on ITV's show. We will also have Brooklyn Borough President Eric Adams talking to us. JFK Medical Center cardiologist Dr. Bhutta Sharman talks to us about how to interpret the number of deaths caused by coronavirus. We will also have Aisha Haki sharing all about event-related situation and giving her advice to brides and grooms. And Dr. Ashish Jha of Harvard Medical talked to us about corona measures. All that and also a special prayer in the form of a song will also be featured in today's Vision of Asia. Stay with us. We'll be right back after these messages. Consul General Sandeep Chakravarthi ji is not just helping Indian American community members in coping up with this extraordinary challenge through various resources. With right information, he has also been connecting with community members on various forums, and he was live interacting with viewers of ITV Gold last week, where he addressed many questions raised by viewers with different concerns. Here are some excerpts from that conversation.
So, while I have you on the show, I have to begin asking you, so much has changed since the last time we had you here in our studio. Stricter measures, a 21 days lockdown in India, so much happening here in the United States. I would like to know, how are you doing and how is the Indian consulate doing right now? I know you are open 24/7 as always.
Yes, you see, we representing India in New York and also dealing largely with the Indian American community, we are doubly affected. We are affected by what's happening here in New York. We are affected by what's happening to the people who live here, the Indian community and the community at large. And also we are influenced and impacted by developments in India. And I think there has been no other phenomena or no other such development which has influenced and impacted our lives as much as COVID has. It has really brought the world to a standstill. Yeah. And disrupted so many things. We have been talking of disruptions, of technology disruptions in the past, but I think COVID has been the most incredible and unbelievable disruptor for our normal life. So what we are trying to do is, first of all, trying to be safe. And I would take this opportunity to request all the viewers and listeners of ITV Gold to be safe. Follow the instructions, stay where you are, stay at home. You are the safest at home or wherever you are. If you're in a hotel, some of our people are stranded here. They're in hotels or they're in hostels, in dorms. Be where you are. I think the virus doesn't come to you unless you go to the virus. So be safe, be where you are. And follow the instructions of your authorities, of your local authorities. I think that's the only thing we can do because if you are struck by COVID, then there is a protocol to follow and things to do. But the best thing to do is not to get infected with the virus and be safe. Be safe. What we are trying to also do is adapt to the new way of life. We are trying to do things online. We are trying to use our media platforms in a larger way. And I'll tell you later how we are trying to become an online consulate and do events and activities online and connect to people, which is what a consulate should do. Earlier, we were physically connecting to people, but now we are virtually connecting to people.
Definitely, sir, and we want to go more into it. But just starting this off and going a little bit deeper into the concerns of Indian Americans, I do want to look into India and ask you more questions on the Indian government's proactive measures and the steps that are being taken place there. But before that, Indian Americans, there have been a lot of concerns. I know the consulate has been getting a lot of calls. My first question to you is, it's actually an anecdote we found somewhere. It says Balaji is amongst thousands of Americans that is in India right now that the US State Department is trying to bring home as the air travel is shuttered by global coronavirus pandemic. Still, the thought of returning back here to Pennsylvania where he lives brings its own sets of concern. Could you reflect on those Indians that are currently in India? I'm sure there must be so much information you must know in that regards.
You see, there are two aspects here. One is Americans who are in India. Right. But we have to remember always that number of American citizens in India is very small compared to the number of Indian citizens in the United States. In fact, the numbers are so strikingly different that we can't even it's not only apple and oranges, they are like peanuts and watermelons. They are just we cannot even compare the numbers. Right. Secondly, we have to understand that entire India is under lockdown. Yes. Whereas in the United States, so far, a large part of the country is under lockdown, but there are still areas which are not under lockdown. So when the American government is evacuating people from US citizens, they are evacuating a smaller number of people and they are taking them to places which are not under lockdown. As far as I know, some of the flights will come to Salt Lake City, which is not under lockdown. But for us, the challenge is enormous. At the moment, no evacuation flights are planned. Also, you have to understand that it is a problem which cannot be solved by evacuation flights. How many people can you evacuate? The numbers are in hundreds of thousands, if not millions. Right. Secondly, who will you give priority? There are all kinds of people who are here. There are students who are here. There are tourists who came here. There are elderly and sick people who came from India to spend time with their families, and they are stuck here. So there is an entire gamut of such people. There are people who came on their job. They will, unless they go back to India, they will lose their jobs. Yeah. Those people are stuck up. So at the moment, I think the best thing to do is to stay where you are and just wait for the suspension of flights to be revoked. And when commercial flights are resumed, you take your flight back and go home. But at the moment, we are not talking of evacuation flights. If somebody is in need, please reach out to our consulate. We will provide you that support. And I want to thank all your listeners and viewers to them, as well as others who have reached out to us. Lots of people are reaching out to us, offering help. Just now I got a call from a friend a person I know in New Jersey. He said that he can provide for 20 meals a day. Oh, wow. And also accommodation for 20 people. So lots of people have come forward offering help. There are others who are coming to me and says, "Aap bataiye hum kya kar sakte?" I think that's the wrong question to put to the consulate. My question to you would be, "Aap bataiye aap kya madad kar sakte?" And then our job is to connect the supply with the demand. We can do that. It's not for us to tell people what they should be able to do or what they can do. So I'm very, very thankful to lots of people, community organizations. I just don't want to get into names, who have reached out to us and offering help. And actual help is being provided on the ground. There are people who are calling Amazon. They are shopping online and getting things delivered to students who are in need. And it is happening right now. So, I am seeing a very positive side of humanity in this moment of crisis, where people are chipping in and they're supporting. And I think, this is the only way we can unitedly, by staying apart, living at home in isolation, but united in action, we can tide over this difficult moment.
Thank you for addressing that question, sir. I have to ask you, there is definitely so much fear and there is a sense of panic that even I feel when I'm reading these questions, these repetitive questions even about different statuses with the same concerns. I have a two-part question to you here. The first would be, how do we truly hunker down at this point? We're still not able to sort of control the situation of coronavirus. And, when we're looking at this fear and this panic, how do you address it to our community? And a little part of that I would like to add, the Indian Americans concerned here about their aging parents, ailing parents in India, about their families in India. How do we sort of calm down the community a little bit right now?
You see, my suggestion to all of you is that we have to make the best out of the circumstances. We have to always count our blessings. We have to always see that people are there are people in the world who are worse off than us at this moment. I am, for instance, you and I are at the moment healthy. We are not infected by coronavirus. Immediately, a person who is infected by coronavirus, howsoever wealthy he may be, is worse off than anybody else who is watching this show. So I think we have to understand this unique and unprecedented situation we are in, and we should, all our wit, all our wisdom, all our knowledge, learning, our compassion, everything that we have at our disposal, it is to be used now at this moment. We have to understand that we are, human beings. We are just a blip in the geological and cosmic time scale. And we have to understand where we are, our place in the world, our place in the cosmos, and deal with the situation. I would actually turn the question around, and I'll say that if you are not healthy and if you are not keeping safe, then what else can you do? I would certainly not recommend reckless behavior. I would not recommend what some people have been doing, partying on the beaches of Florida, or going for a religious congregation. I think that's very silly to do, because you can hurt yourself, not only yourself but hurt others. So I think you have to be composed. You have to understand the situation. You have to, use tools that wise people have given us, like meditation, yoga, physical exercise. Read, connect to people. Use social media to connect to people. For instance, I am trying to move my working of my consulate online, and I'm trying to normalize functioning of my consulate, and we are now planning to roll out large number of events. Where we can connect to people, educate people, learn from them, and have a two-way communication. Because I think only at this time you need to communicate. Even if you're over communicating, I think that's the solution to the problem that you are raising. Is that connect to your family, connect to your parents, talk to them on Skype, on social media, on WhatsApp, call them up, do a Zoom conference, do house party. People are partying or virtually. So people have come out with a lot of innovative solutions. बट टू से कि मैं घर में बैठा हूँ, मैं उदास हो रहा हूँ, मैं परेशान हो रहा हूँ, मेरे पास जगह नहीं है, मेरे पास ऐसा नहीं है. टू मी पटेल ब्रदर्स बंद हो गया. अरे पटेल ब्रदर्स बंद हो गया तो मैकडोनल्ड तो खुला है, पिज्जा किंग तो खुला है, पिज्जा हट तो खुला है. तो जो है खाने को वही खाइए ना भाई साहब. अब दाल चावल जरूरी थोड़ी खाना है. So I think we have to make the most out of it. This is a very humbling experience for all of us. We should know how to deal with the situation. And I'm sure we'll all come out stronger from this. But if you feel panicked and depressed, and then I think the virus wins. We have to be strong. We have to be determined. We have to connect to each other, support each other, call up people. We are always calling people at the time of need. But call up people, call your uncles, call your relatives, call your friends you have not spoken to for years. Call them up and find out how they are doing. I think that will make a world of difference to the person that you are calling. We have been getting hundreds of emails, and we are making sure that we call up each and every person. And every call matters, and people's spirits have lifted. I have been myself calling up people and saying how you are doing, and I think it makes a world of difference to their lives. So people who are feeling depressed and panicking, all of us have phones these days. We have Skype, we have laptops. Call up the people that a childhood friend, or post something nice on Facebook, post something nice on Instagram. The spring is around. Look out of a window, see the cherry blossom, take a picture and post it. I think that will spread so much of cheer in the world. And all of us, if we all of us spread a little bit of cheer, I think it will be a very cheerful space, and coronavirus will lose, and humanity will survive.
Brooklyn Borough President Eric Adams was kind enough to spare times to talk to viewers of ITV Gold, even though he was on the field and while visiting various hospitals, he squeezed some time to connect with us via Skype. Here is the ground situation about various measures being taken by the administration right from the field, with Brooklyn Borough President Eric Adams talking to our own Aditi Lamba.
Today, you addressed the New York City Department of Correction, asking for, the workers there as well as the inmates to be protected better. I just want to start this off asking you how that address was and a little bit more insight into it.
Well, it's important that not only the prisoners receive testing and personal protection equipment, but also the countless number of correction officers, our police officers, our firefighters, all essential employees that will allow this city to continue to function through this crisis. They must be protected also. Unlike the September 11th attack, where many police officers received 9/11 related injuries, they didn't take those injuries home to their families. With coronavirus, if you are infected, you're going home and you could have long-term impacts on your families. As a former police officer, I know what that means. I know that we're starting to lose far too many people. We must isolate, contain, and give the proper protection equipment to those that we have placed on the front line.
So what are the demands right now, sir, if I was to ask you from the Department of Correction, what are you hoping to get for these inmates and also the workers that are working there?
We want them to have personal protection equipment. This allows the virus not to spread, and also it ensures that we are not putting people in harm's way. And it goes beyond the walls of our correctional facilities. It must be an immediate response from our entire city to protect those we're telling that they must go to their place of employment to keep the city running. Those are train operators, bus drivers, grocery clerks. All of these people who have stated they are willing to sacrifice their lives to protect us and to serve us, we must make sure they have the items they need to protect their families and protect themselves individually.
Definitely, and I truly appreciate you for bringing forward this really important topic, PPE. We are discussing this with everyone. I want to address, the medical community here with you, sir, and also all of the healthcare workers. Again, PPE is a huge issue for them as well. We actually had a doctor come and address the fact that she hasn't had a proper mask for 5 days, and she's reusing it because that's the only thing that she can do. And she's located in New York City. Your address to the medical community, the professionals, what insight could you give us in terms of what is being done by the borough office right now for these, healthcare workers and the medical workers?
It is the job of the city and state to get the equipment to them. I am in my car right now, and I'm going to show you a picture. These are boxes of masks that I just picked up and collected. I'm driving around to hospitals to deliver them to nurses and other medical staff. This is an indictment on our country on a whole, that the richest country on the planet, we don't have basic supplies for our healthcare employees. This is really an embarrassment for America, an embarrassment for New York State and New York City. We should be able to provide our citizens with the equipment that they needed. I should not be driving around the city giving out personal protection equipment to our healthcare professionals in the most affluent country on the globe, in the most affluent city.
So I have to ask you, I know you have visited certain locations, you have visited emergency rooms, you're currently going and you are delivering PPEs yourself. This is absolutely amazing. Could you tell us a little bit more information about what is happening on the scene and how important it is for you to right now go and deliver these? A little bit insight into these doctors, these professionals, and what's happening on these emergency rooms that we keep on hearing about is like a war zone.
Yes, it is. It is the war zone. It's the war zone in America. And as in any war, there's a front. The New York City is the front, and Brooklyn is ground zero of that front. We're the epicenter of this serious issue. And as we are at war, you will not send your men and women into battle without the proper equipment to protect the country. And we're doing that now. And those of us who feel that we have an obligation and responsibility, we're going to the front line. We're on the front giving these supplies. These boxes here with me in the car, they're real, they're resources, just as any military person will be relieved when they know that bullets are coming to them so they can protect the country. When I bring these masks to our frontline people, they're saying that they know help is on the way. These are real boxes. I have 6 or 7 boxes here in the car with me that are masks that our nurses and hospital staff could use because this is a very serious issue and we have to take it in a very serious manner.
And sir, how were these equipments that you're traveling with right now received to your office?
Volunteers and donation. People have donated masks to us. We have everyday New Yorkers who have reached out to contacts and were able to get these PPEs. Some doctor's office who had boxes or a box or two, we collected from them. Other dentist office who may have a box or two. Some private practices that have closed down, they have given us a box. So we've moved around the borough in the city and collected boxes so we could get beyond the bureaucracy and go right to the ground, to the hospitals, and give it to the people in need.
Wow, and I think that's absolutely fantastic. You know, this sort of brings me into a more interesting topic, just something a little bit more on the official side of it here. You know, I know you have called upon the local and state governments to support Brooklyn even more during this crisis. Brooklyn is an epicenter. We're here in Queens. We're not too far. We're all in the same situation here. Could you give us an insight into your communication with local and state governments, and what is your greatest need of the hour right now while you are traveling again on the road delivering the PPP?
You know, keep in mind, New York City has 5 municipalities. One of them is Brooklyn. Brooklyn is the largest of the 5 with 2.6 million people. If it was a separate city, it would be the 3rd largest city in America. And we are extremely diverse, with 47% of the people speak a language other than English at home. So we have to communicate with people in a language they understand, and we have to get the resources to people, because we have to fight this battle on 2 fronts. One, we have to fight it inside our medical facilities to make sure we assist those people who are in need of emergency care. But we also have to prevent the feeding of this crisis by educating, communicating, and giving assistance to people who are inside the borough. If not, we're going to have a continuous flow of people who are going to receive the virus and always be in a crisis mode. You cannot defeat this virus by being in a crisis mode. You have to stop some of the crisis from occurring in the first place.
Dr. Bhutta Sharman from JFK Medical Center and Dr. Luis Amato were forthright in explaining how to interpret the number of figures related to death caused by coronavirus and comparing it with other flu epidemics. Here is Dr. Bhutta helping us process all that we are experiencing in the form of number of increasing casualties right here in New York, America also.
What we want to educate the American people about is how to interpret the coronavirus pandemic numbers. We hear on the TV that so many deaths occurred every day. That is creating panic and fear, because people do not understand the numerator and the denominator. The numerator is actual, is factual, because that is the number of deaths that have taken place from the coronavirus. The denominator is actually low because we have not tested everybody. So when we talk about a fatality rate of 1.6, we are talking about number of deaths divided by the number of cases tested. In actuality, it is number of deaths, with the denominator being number of cases that got the infection in the first place. So if you add asymptomatic people to the number of patients that were tested, that denominator becomes a big number, and the case fatality goes down. So if we start comparing these numbers to any large flu epidemic, we'll realize that these numbers are much lower than any large flu epidemic. Last year, for example, there were 34,000 deaths from the flu virus in the United States. The flu season runs, let's say, from October to the end of March. So let's say 6 months. So that would be 26 weeks. And if you divide 34,000 deaths With 26, you get a number of 1,300 deaths per week on average. Now, these are not constant because in 1 week they may be less, in the other week at the peak of the season they may be much higher. The corona epidemic has not reached these numbers yet. We have not had any deaths more than 1,300 in any week in the United States. So this is creating fear and panic in the public. We want to do this educational video so that people understand these numbers in context to what can happen in any large flu epidemic. So instead of fearing the epidemic, we do the right things to contain it. Yes, we have to take all the measures to try and prevent the spread of this virus. We need to wash our hands. We need to mask ourselves. We need to have social distancing. So all those things do work and are necessary. But it is also necessary that we don't promote fear and panic in the public by always quoting the number of deaths that particular day or week. We should tell them how it compares to other epidemics and that we are still okay. We should still continue to do what we need to do to prevent the spread, but not be taken by these numbers because they really are not true numbers, as I just said in my previous statement. One other thing that I want the American people to know is that not to rely on anecdotal information, observational information, but to rely on randomized trials that show effectiveness of drugs and vaccines. What is happening in the public is that we hear 3 people got better using a hydroxychloroquine, then everybody wants it. And then we make observations which are inherently biased. So the best way of knowing whether a drug is effective or not is randomized controlled trials. People have been talking about them, the trials have started. So it may be prudent to wait and see what these trials show. Now, in a desperate situation, a doctor can use whatever he wants. But for vast majority, we should wait and find out if these drugs actually work, because you may be doing some harm by using it in a manner which is not really proven to be true. Case in example is people are using hydroxychloroquine and a few of them have died because they had cardiac conditions and had prolonged QT interval. Anything else to add, Lou?
Dr. Sharma, I agree with everything you say, and also follow the numbers, follow the data. Don't react to the 2 cases that somebody knew someplace. But if you follow the data and the numbers, they'll lead you to the more logical and conclusions. And if you do that, you should be at least calm in your approach to this.
Aisha Haki has a long experience of connecting with community members through her magazine BB, and she has also been at the forefront in organizing various events. In this special situation caused by coronavirus related crisis, how brides and grooms should perceive and what way they can move forward with their respective plans. Here are some special tips of advice and insight by Aisha.
Just in terms of talking about, this specific topic, Aisha, and thank you again for coming and addressing the needs and the concerns of the event management world right now. You must be getting several questions from brides and grooms right now who were preparing for their wedding in the next few months, maybe this month. In terms of the weddings or in terms of other events that had been planned and have to be cancelled, what have you seen as a process so far? And I know insurance has become a huge issue in this world as well right now as we're talking about COVID-19 and its impact. Talk to us about what is happening in terms of these brides and grooms who were waiting on their events, and also on the insurance, which is a huge part of this entire business. You told me earlier that they actually cannot rely on it for COVID-19.
Well, so what's happened? Okay, so before this all happened, I always tell my brides and my people who are having events to get event insurance. It really helps, especially if, we've had so many natural disasters in this country recently as well, that if there is a problem and one of your vendors, an important one, can't provide
Right.
the services, you can either get the deposit back or you can, help negotiate the contract so that way you're covered.
Right.
So a couple weeks ago, you were able to get insurance, that would cover COVID-19 because that would be considered force majeure or an act of God, and it would have been covered. Well, I tried to call for a wedding that I'm doing in the late summer, and I called the insurance company and said, "Hey, can you talk to me about COVID-19? What's going to be happening?" And they've since changed their policies, and they're calling it a known cause, which I believe that's an insurance term. And so now they're not covering anything that has to do with COVID-19, whether that's postponement or cancellation of the event.
Oh, wow.
So how are we working around that? Luckily, most people in the event industry, they know, we're all in this together. We're all working together. I mean, that's the beauty about being in America, is that we all do
Right.
come together when times are rough like this. So we're working with our vendors on a case-by-case basis. We're trying to work with our brides on a case-by-case basis. What we're doing is we're now moving forward with putting 2 dates into the contract.
Right.
So if we have a summer wedding planned, we're asking for an alternative hold on a date in the fall or in next year, depending on what the bride and groom want to do.
Right.
And so this way, it helps us plan with all the vendors, making sure that the whole group of people who are working on that one particular wedding will be available for the next the alternative date. And if that doesn't work out, then we have time to be able to find other vendors or other venues that will be able to handle that particular wedding.
Wow.
So ultimately, we have to be flexible right now. We have to talk with the vendors and also make sure that you're looking at the contracts very carefully, so
Yes.
that way you can sort of, not lose your money moving forward.
Aisha, for everyone that's watching you right now on ITV Gold, could you perhaps, I think this would be really interesting, break down the entire team that is required in an event planning business, and especially when it comes to weddings? You had just highlighted on the fact that you have to communicate with the vendors, the venue, and other parts of the entire system in order to perhaps even give an alternate date to somebody who's looking to get married or have another event. Could you break down how many people are currently impacted by this and who is in the chain? Because it is everybody, as we're talking about.
So it's a couple different things. So obviously, the number one thing that you have to look out for is your venue, because I look at it this way: when you're rescheduling a date, look at the factors that there is only one of. So, for example, your venue, there's probably only one of it. And
Right.
so if you have your heart set on, saying, getting married at the plaza, whatever, you want to first talk to them and find an alternative date. Then look at set your vendors in a sense of who you want the most. So if you particularly want a particular caterer,
Right.
caterers can usually handle multiple events per day. So they're probably going to make adjustments and work with you. The problems arise, like say you want a particular, like me, if you want a particular event planner, I've got to make sure that my schedule is available, or that my number two will be able to handle the wedding in case I can't be there. Also the same with photographers. Usually people hire that particular photographer for their talent. And if they're one person, they can't be in multiple places. So you've got to find out who their number two is going to be. So just like that, you go down the line from florist to decorator to calligrapher to DJ. Find what's the most important to you,
Right.
and then start adjusting your dates according to their availability. And be patient. Everybody's in this together. We're all working on this together. We're all trying to deliver the best possible experience for our clients,
Right.
but we're all trying to get through this. So yeah, it's going to be different. It's going to be a lot of fun when it's over.
Dr. Ashish Jha of Harvard University talked to us via Skype about measures being undertaken to counter the threat posed by coronavirus. Here are some experts from his conversation via Skype with Aditi Lamba.
So I wanted to discuss, South Asians in general, since we have you for about 10 minutes right now on the show still. India is getting hit massively by coronavirus. They're on a 21-day lockdown. We're hearing news. Pakistan is doing the same thing. It's, increasing its measures. Singapore is on a complete shutdown. Malaysia is still letting certain situations happen around it. Your take on the impact, towards South Asia of COVID-19, and also we have a lot of concerned Indian Americans and South Asian Americans that are concerned about their families back home. What do you have to say to those communities, and just in general, your take on South Asia?
Yeah. So I'm very worried about where things stand in South Asia. And first of all, I want to say about India that I'm very supportive of the 21-day lockdown. That's clearly a good idea. But what I'm worried is that we're not using those 21 days to do all the right things. So you have to understand that the lockdown won't cure the society of the virus. The virus will still be there. It'll just bring the infection rate down.
Right.
The moment you let the lockdown go, the infection will come back. So the question is, why are you doing the lockdown, and what are you trying to get out of it? And you want to do two things. You want to spread those infections out. But if you don't want to have to do another 21 or 28-day or 49-day lockdown 2 months from now, you need to use the current time wisely.
Right.
And the two most important things that India and Pakistan and all of South Asia needs to be doing is, one, substantially increase testing. You need to be testing large numbers of people. This is what South Korea did. And you need to be identifying people who are infected, and you need to be isolating them.
Right.
And second is you've got to be getting your healthcare system ready. PPEs for doctors. I know there have been a lot of complaints in India about the quality of the PPEs for doctors and nurses. Again, if doctors and nurses start getting sick, they just will stop coming to work. It's going to be a disaster. So both of those things are very, very important. And I want to make sure that the Indian government and the states are working on expanding those two issues. Otherwise, it's going to be a huge challenge.
Do you think India is currently ready, Dr. Jha? Do you think they are enough prepared with whatever measures they're taking right now, with the quarantine, with the vaccine trials they're also doing amongst themselves? Your take on, will India be able to combat cases as high as the United States if that happens?
Yeah, so I'm pretty worried that they will not, and that the number of cases in India will end up surpassing maybe any other country in the world. And while, again, I think the lockdown is a very good idea, very supportive of it, I don't see enough happening on how India will be able to open up and stay open. And it'll be very hard politically to do another lockdown. And you don't want to waste the lockdown. So you want to use this time wisely. And when I'm looking at the data coming out of India, talking to people who are in the leadership there, I don't think that the Indian government is using this time as aggressively, as effectively as it needs to be. And I'm very worried we're going to see a large increase in cases, maybe not in this summer, but certainly into the fall.
And in terms of just discussing a little bit more of that, we're looking at such troublesome numbers, Doctor. We're looking at, us really not knowing what's going to happen next week. How do we truly hunker down? The entire problem is the fact that people are still outside. People are still not obeying social distancing. How do we really control the situation, especially when you're looking at huge countries such as India or the United States?
Yeah. So a couple of things. I mean, first of all, for people who are not doing social distancing, people who are still going out, still socializing, you have to understand that you're putting yourself at risk, you're putting all your family at risk, and all the work that everybody else is doing, staying at home, you're making it less effective. So it's incredibly selfish for people to be not social distancing right now, and they need to cut it out and they need to stay at home. That's message number one. Message number two is what I suspect will happen is when number of cases spike in communities where social distancing is not happening, governors will turn this into legal action where they'll have to enforce it with the police or even the National Guard.
Yes.
I don't want to get to that point where we're having to have police enforce, but that is where I suspect we may end up going, especially in communities where people are not taking it seriously. In India, of course, this is a huge challenge because we have large migrant populations. You have a police force that is not necessarily all that trusted to do these kinds of things.
Right.
So India is going to have a harder time enforcing social distancing, meaning it will be less effective, meaning that there will be more of a risk of a case, of serious disease outbreak. And that makes the testing issue even more serious because I don't think social distancing is going to work as well in India for all the issues, all the reasons I have outlined.
So, Dr. Jha, in that case scenario, what do you require from our administration right now if we want to really, make the situation better next week, be better at just holding our hospitals to a capacity that they can treat patients? What are we calling at the administration for right now? According to you, where do we have to work? Is it local? Is it state? Is it federal level? According to you, where do we need to right now focus on?
Yeah, great question. So right now, there are two tasks, two jobs ahead of us. Job one is getting through the next 4 to 6 weeks. Job number two is preparing for the summer and fall.
Right.
So for the next 4 to 6 weeks, we have to be doing three things. We've got to keep everybody at home. There's still states that haven't fully implemented a stay-at-home order. It's crazy. Every state should be doing that.
Right.
And every community should be enforcing it. And if you know people who are not staying at home, you should call them up and tell them to go home. Second is, I know I've said this several times, our testing infrastructure in the U.S. is still not where it needs to be. Still too many people who can't get tests that they need. We need to ramp that up. And third is, right now, the federal government, all the state governments have to be focused like a laser on making sure there are enough ventilators, making sure there are enough PPEs, personal protective equipment for doctors and nurses.
Right.
Because I am very, very worried that doctors and nurses are going to start getting sick in very high numbers, and you're going to have the whole healthcare system collapse because there are not enough doctors and nurses. That's what we need to do in the short run.
How much testing are we looking at?
Expanding our testing infrastructure,
Yeah.
thinking about how we're going to do quarantines. There's a lot of work that needs to be done so that we can open up and stay open. For your viewers, what I would say is you need to be talking to your members of Congress. You need to be talking to your governor. You need to be talking to people in your state legislature and asking what are they doing to make sure that when you open up again, that you can stay open.
Yeah.
What are they doing to make sure that doctors and nurses are being protected now? What are they doing to make sure that there's enough testing? And, I think too many people don't know what to do. They're at home, they're frustrated. And I would say those are areas where you can push your political leaders because this is going to take political leadership. And the political leaders respond to pressure from the public. Right. So if you're a part of the public, you need to put pressure on your political leaders to do the right thing so we can get back to our lives.
Definitely. Dr. Jha, we are coming towards a close of this interview, but I really want to address this one question to you. There are thousands and thousands of medical and healthcare workers that are working tirelessly on the front line, first responders, police, and so much more. I would love for you to address your community of doctors, nurses, and a message out. I'm sure they would love to hear from the director here and see what he has to say to them.
Yeah. The only message I would say to people, the first responders, the doctors and nurses, is you guys are the heroes. You are the ones who are keeping our society functioning. You're saving people's lives. You're risking your own. While everybody else is running away from the coronavirus, you are running towards it. And it is our moral obligation to protect you. But I think the whole nation is deeply grateful for the work that frontline workers, doctors, nurses, respiratory therapists, ambulance drivers, firefighters, police officers, these are the heroes that are really on the front lines of the coronavirus, and we owe them a great debt of gratitude.
Yes, I totally, completely agree with you. And I thank you for your service and all of your effort and all your advocacy. Just one last message to all of the ITV Gold viewers that watch you live right now.
I want to say stay at home. Wash your hands, and call up your representative, call up your political leaders and tell them you're watching and you want them to be taking action, protecting doctors and nurses and making sure that we are ready to open up as soon as it's prudent to do so.
While it is important to take care of each other, observe all that needs to be observed in terms of social distancing, not shaking hands, covering your face, etc., the ultimate solace that we all seek from the ultimate, the Almighty, also is very important, and it plays a crucial role. So here in today's Vision of Asia, we will conclude with this special prayer where the idea is that we all come together in faith as one and pray for the world, for the humanity. These words of special prayer for those who lost their lives from coronavirus, and for those who are still affected. May God heal them and give peace to everyone worldwide. The song being presented by Eric Gill and Annie Gill. Music Sherry Khan, and the song was written by Sahir Ludhianvi.
तेरी है ज़मीं तेरा आसमां तू बड़ा मेहरबान तो बख्शिश कर सभी का है तू सभी तेरे खुदा मेरे तू बख्शिश कर तेरी है ज़मीं तेरा आसमां तू बड़ा मेहरबान तो बख्शिश कर सभी का है तू सभी तेरे खुदा मेरे तो बख्शिश कर
तेरी है ज़मीं तेरा आसमां तू बड़ा मेहरबान तू बख्शिश कर सभी का है तू सभी तेरे खुदा मेरे तू बख्शिश कर
तेरी मर्जी से ऐ मालिक हम इस दुनिया में आए हैं
तेरी मर्जी से ऐ मालिक हम इस दुनिया में आए हैं
तेरी रहमत से हम सब ने ये जिस्मो जान पाए हैं
तू अपनी नजर हम पर रखना जिस हाल में है ये खबर रखना तेरी है ज़मीं तेरा आसमां तू बड़ा मेहरबान तू बख्शिश कर सभी का है तू सभी तेरे खुदा मेरे तू बख्शिश कर
तू चाहे तो हमें रखे तू चाहे तो हमें मारे
तू चाहे तो हमें रखे तू चाहे तो हमें मारे
तेरे आगे झुका के सर खड़े हैं आज हम सारे
सबसे बड़ी ताकत वाले
ज़मीं तेरा आसमां, तू बड़ा मेहरबान, तू बख्शिश कर सभी का है तू, सभी तेरे खुदा मेरे, तू बख्शिश कर। तेरी है ज़मीं तेरा आसमां, तू बड़ा मेहरबान, तू बख्शिश कर सभी का है तू, सभी तेरे खुदा मेरे, तू बख्शिश कर।
Before we conclude today's Vision of Asia, here is a reminder. Do join our Facebook page. Be friends of ITV Gold Facebook page. Subscribe to our YouTube channel and keep writing about various event-related information to us at events@itvgold.com. Thank you very much for joining. Stay safe. Stay at home. This is Ashok Vyas signing off from today's Vision of Asia, a voice of the community.